Mental health has taken a toll because of the pandemic, but there's one thing parents can do to help.
Yeah, Taryn, experts say it's something they think they're doing well but can improve on to help their teenagers.
Mental health issues were already growing pre-pandemic. Experts were seeing a spike in suicides. Then COVID happened, and things got worse.
Shutdowns and quarantines and people losing their jobs, people being isolated.
That's Dr. Jeffrey Guina of Easterseals of Michigan. They're the largest provider of mental health services in the state. So what's the cause of the increased problems teens are particularly facing? Well, restricted access to healthy coping skills are missing.
Going out with friends, exercising, maybe going to church, synagogue, mosque, wherever, those things that help them cope and deal with life. When those things are restricted, then unfortunately, some of those unhealthy coping skills move up the list.
He's talking about drugs, alcohol, and yes, even suicide. Dr. Guina says in Michigan alone, they've seen a 25% increase in suicides during the pandemic. And drug use has also spiked. There's a 20% increase there.
I think, unfortunately, we're particularly seeing that increase among young people who may be restricted from living life normally, going to school, playing sports, going to prom, doing all those things that are really important for their development.
Fear, isolation, and stress combine into a dangerous trifecta. How do you know when a young person is just dealing with the blues or if they're dealing with something much more serious?
I think sometimes it's impossible to know. I think in the snapshot moment, but with ongoing communication, paying attention over time, you'll get a better sense of, okay, this was a bad day. We all have bad days or bad weeks, or this is persisting. This is going on. We really need to do something.
And finally, listen. Parents think they're doing this when they're not.
You want to fix everything. You want to make things better, and you feel helpless when your child maybe is struggling with something, and that's when we tend to have that instinct to go in there and fix everything and tell them what to do and advice, and sometimes the listening is just way more powerful.
That's hard to do for parents, to just say, okay, I'm just going to listen and not try to fix.
Like I said, it's easier said than done. We all say we listen, but a lot of times in that moment, even the best listeners start, putting in their 2 cents.
You know, there's a difference between hearing someone out and actually listening to them. And Taryn, you're a mom. You know this. When it comes to something that your child is dealing with, you want so badly to go in there and offer words of wisdom. But they're saying oftentimes, this is a psychiatrist who we interviewed who's saying, if you just become an active listener and let them have you as a safe sounding board, it can really move the meter.
Well, it is true. We all want to fix it. The parents don't want to see their kids suffer, but really they have to learn how to be able to cope and deal with these things on their own, and maybe just hearing themselves working through it, out loud as they're talking to a parent might help that happen.
Understanding a parent who's listening and understanding with their eyes can go a long way. By the way, the number for the suicide hotline, in case you or someone you know is struggling, there's help out there right now 24 hours a day. The number to call is 1-800-273-8255.
So important. Thanks, Roop.